Good morning, everyone. To start, I want to note at 6:30 a.m. in front of the State House, we placed a wreath and lowered the flag to half-mast, and just a few minutes ago at 11 a.m., we held a moment of silence in honor of National Peace Officers Memorial Day to recognize those we've lost in the line of duty. I send my gratitude and appreciation to all the brave men and women of law enforcement who keep us safe every day. As I pointed out on Wednesday, we're now 2 months into the state of emergency, but I've got to admit, it seems like a year ago. It's incredible to think back on all that's happened since early March. We've all been through a lot. In the beginning, we saw how quickly things closed down, one by one. And now our emotions are raw as we methodically reopen. While this has been difficult for all of us, I just want to say how proud I am to serve as your governor, seeing Vermonters step up time and time again. From the beginning, you've followed our guidance, stayed home to slow the spread, and kept our healthcare system from being overwhelmed. Your efforts have saved hundreds and hundreds of lives, and your sacrifices made a real difference. Even as we've slowly restarted the economy over the last 4 weeks, we continue to move in the right direction. In fact, we have the lowest 3-day and 7-day growth rates in the country. This is good news, and as Commissioner Pichek will present this morning, our data shows we can continue down this path. And as he said last week, there are 4 metrics we're watching for our restart strategy, indicators that tell us we're okay to keep moving forward or we need to take a pause. I want to talk about these again this morning so folks can understand what we're looking at to gauge the impact of the steps we've taken over the last 4 weeks, and as we turn the spigot a little bit more at a time. I also want to note these metrics align with the strongest CDC guidelines for reopening. First, we have what scientists call syndromic surveillance. What this means is we're watching the percentage of people getting care for a COVID or flu-like illness. Second, we look at viral growth and reproductive rates. These tell us whether the virus is growing or shrinking by looking at cases over 1, 3, and 7 days. Third, we watch the percentage of new positive cases. As we've said, it's very likely that we're going to see an increase in positive cases, not only because people are moving around more, but because we're testing more every day. So instead of looking at total cases, we need to look at what percent of total cases are positive. And finally, but importantly, we have to monitor ICU and critical care beds. These are data points we look at every single day, along with our overall trends and supply lines. Commissioner Pichek will give you an update shortly on what we're seeing in these areas. And while our trends remain promising, we know we're not out of the woods yet, especially as our neighboring states and Quebec are still seeing more cases and more deaths. That's why today I've extended the state of emergency until June 15th. This will allow us to continue responding and managing this public health crisis while we transition out of it. We're also relaxing the stay home, stay safe order by aligning it with the sectors and social activities we're already allowed to open and with our restart strategy. Because of the success we've had, we're now asking Vermonters to be smart and stay safe. Here's what's important to remember. Even though we've allowed more to return to work and more activities outside the home, and will continue taking more steps forward based on the data, we still need everyone to pay attention and stay vigilant. And if we do, we'll be able to get out a little bit more. But staying close to home and limiting the number of people you come in contact with is still really important. This is especially true for those over 65 and those with chronic conditions. If you fit in these categories, you should continue to stay home as much as possible. Now, I know it's hard, but it's really, really important. This order also includes our next turn of the spigot, which was announced on Wednesday, allowing more limited openings of our campgrounds, marinas, and lodging facilities. But they must comply with safety guidelines, capacity limits, and cleaning requirements. This will begin next Friday, May 22nd, and Secretary Curley will provide more details in a few minutes. This order also encourages mask use while in public, except in certain situations where it's unhealthy to do so. And as I've said, I continue to think we'll see better compliance through encouragement and education than we would with a mandate. But understanding every municipality has different needs, we've come to the conclusion it would be appropriate to allow them to implement more strict requirements. So we're allowing them to do so. But city councils and select boards have to take affirmative action as a body. And if the data continues to move in the right direction, we'll be turning the spigot more and more. Between now and June 1st, you can expect us to open up close contact businesses like hair salons, indoor professional services, outdoor dining at restaurants, and increasing gathering size to 25. Again, this is if we continue to move in the right direction. And to be clear, these are decisions made with the Department of Health every step of the way. As I've said before, this is literally in our hands. So what's really important to remember is the smarter we are and the more disciplined everyone is during each step forward, the more steps we'll be able to take. We all have a role to play, and we can continue as we continue to slowly turn the spigot while suppressing the virus and protecting each other. I thank you all for what you've done over the last 2 months and your ongoing commitment to keeping everyone safe. And with that, I'll turn it over to Commissioner Pieciak.
Good morning, and thank you, Governor. I'm Mike Pieciak, and I serve as the Commissioner of Vermont's Department of Financial Regulation, and I have been leading Vermont's COVID data modeling team as well. This is our 7th public briefing on Vermont's modeling efforts. I will again start by overviewing recent trends and forecasts, and then we'll further discuss the 4 key data metrics we are planning to closely monitor as we continue reopening Vermont. Again, for those watching at home who would like to view our full presentation, you can visit the Department of Financial Regulation's website at dfr.vermont.gov to find all of our presentations and modeling resources under our COVID-19 Resource Center. This week, we are reporting a common theme. Vermont's trends are continuing to improve, and we are performing better than forecasted. In fact, Vermont's COVID-19 experience stands out for its success regionally and serves as an example nationally of a state well-positioned to safely and strategically reopen its economy. Vermont's actual experience continues to perform better than anticipated. As the chart details, our actual confirmed cases, represented by the thick blue line, continues to trend in a positive direction, well below our previous forecasts, even below a forecast we ran from earlier this week. Vermont's doubling rate has noticeably improved as well. We do not expect our cases to double in Vermont for over 40 weeks, up considerably from 12 weeks just last Friday, making our doubling rate the 2nd slowest in the country. On the next slide, we see a comparison of the doubling rates across the Northeast. I'm happy to report that each of our neighboring states has either seen improvement in their doubling rate or has held steady from the week before. Further, as the Governor alluded to, Vermont currently has the lowest 3-day average growth rate in the country, standing at a mere 0.18%. We are fortunate to continue to see positive trends regarding the number of Vermonters requiring hospital care and also seeing a decline in the number of active cases, all of which are good news for our state. I do want to take a moment to point out how the trajectory of COVID-19 in Vermont compares to the rest of the country. This next chart shows the 3-day average growth rate across the country. As I just mentioned, we're currently the lowest by this measure. And what's more noteworthy is when you compare the other two states that are in a similar position to Vermont, Hawaii and Montana. One is an island and another is in a more remote part of the country without major metropolitan areas close by. And while we may have a smaller and more rural population than many states, our current positive position was not predetermined. Vermonters are at the center of this success. There is no question that we have made many sacrifices while at the same time adhering to public health guidance about the pandemic. Vermonters continue to embrace science and public health, and this result leads us to not only better than expected COVID-19 trajectory, but has also made Vermont a national leader. We continue to keep our eye on mobility data as well. The chart on the right shows that Vermonters continue to limit their travel outside of their homes. Further, the chart on the left actually we continue to compare favorably to the rest of northern New England. To shift gears to the restart metrics, last week, as the governor mentioned, we announced the 4 metrics we will closely monitor as we gauge the impact of reopening on our state. Again, these 4 metrics are syndromic surveillance, viral growth and reproduction rates, the percentage of positive new cases, and finally, and probably most importantly, the availability of hospital and critical care facilities in Vermont. Our first metric, syndromic surveillance, which again reports how many Vermonters are visiting emergency care centers with COVID-like symptoms, is trending in the right direction. We have a warning flag of about 4% of visits to critical care facilities. We're trending well below that and have been trending below that for a number of days. Our second metric is the viral growth rate and reproductive rate. As previously mentioned, our numbers continue to decline, with both our 7-day and our 3-day averages showing growth under 1% for the past 12 days. As the data reported out late last night, yesterday's growth rate was about 0.11%. The second metric, monitoring viral growth rate, is also trending positively. We are seeing both our 3- and 7-day averages declining over the past 14 days. Our third data point is the percentage of new COVID-19 tests that come back positive. Similar to the other metrics, these are trending positively and well below an area that would give us pause for concern. Our fourth metric is hospital and critical care bed availability. As of today, we have just 1 patient with COVID-19 in the ICU in Vermont, and our numbers continue to trend in a positive direction, giving us confidence that we will have the capability to serve Vermonters in our hospital care system if there is a significant shift. If you remember, we have spoken a lot about the delay in the virus transmission between coming into contact with the virus and having a confirmed case. On average, that delay could take between 10 to 14 days. On April 20th, we took our first small step toward reopening Vermont's economy, and this graph shows us that during that time frame, we didn't see any considerable uptick, and the volatility that we saw would be normal and expected, given the low number of cases we reported. On April 27th, we took our second step to reopen the economy. Again, we saw a slight variation in the growth rate, but at the end of the 14-day window, the viral growth rate was in decline. We will continue to monitor these periods of time as we go forward as additional steps are taken to reopen Vermont's economy. This week, the results show that our progress continues to be positive. Our doubling rate has lengthened to 40 weeks, and our 3-day growth average is the lowest in the country. One of our modelers told us this week that Vermont is actually in a good position to reopen compared to the many other states that modeler is working with, including the federal government. However, it's important to note that we did not get here by chance, but we got here by being smart and being safe, by following scientific evidence and public health guidelines, and we intend to keep doing this as we keep a close eye on our public metrics. And with that, I would like to introduce Secretary Lindsay Curley.
Thank you, Commissioner Piczek. Good morning, everyone. I wanted to start off by saying that as we continue to restart Vermont, there is no one sector or industry that will fully return to business as usual on day one of their restart. As the governor and our team at ACC and ACCD engage sectors and businesses around reopening, our phased approach requires all businesses to think about different ways they can operate to ensure the safety of Vermonters. We are pleased to report that many sectors are developing reopening safety plans and collaborating with us to do so. This process helps us understand realities on the ground that we can pair with health data from Commissioners Levine and Piczek, as well as others, to find a path forward for each industry. We are pleased to report, we also want to note that as more sectors open, there are a set of mandatory health and safety requirements that apply to all businesses. Things like employee safety training, health screening, and developing safety plans are critical to avoiding future business or social disruption in the weeks ahead. Please make sure you review all health and safety requirements in addition to your sector guidance. There is a step-by-step guide to reopening available at accd.vermont.gov by clicking the red Work Safe Training Resources banner. The lodging and accommodations phased reopening announced today is the latest example of a sector reopening that looks different than it did before this pandemic. Here are a few high-level points about the guidance that we are releasing today. Effective May 22nd, lodging operations, short-term rentals, campgrounds, and marinas may accept overnight reservations from those who have met the 14-day quarantine requirement. Operations may only book 25% of their capacity at this time. Vermont residents and those who have met the quarantine requirement will be required to complete a health questionnaire and certification confirming they meet the quarantine requirement and that they have not had symptoms. The Agency of Commerce has made a model certification document available on our website. If a property is currently housing semi-permanent, seasonal residents, including those housed by AHS clients, or essential workers, those guests do not count against the 25% capacity. Standalone cabins, cottages, and short-term rentals are exempt from the 25% limit. Check-in should be done online or by phone to the greatest extent possible. Operators must ensure there are no gatherings of more than 10 people on the property at any time. And direct services such as check-in, bell, valet, and housekeeping must be limited to the greatest extent possible. Food service may only be offered as takeout or delivery in compliance with the current restaurant guidance. And operators must maintain a full guest log for 30 days in case contact tracing is required. We encourage everybody to read the full guidance at our website. We also want to remind all Vermonters that the 14-day quarantine does apply to them as well. If Vermonters have left the state or are returning from wintering in other states but hold a Vermont ID, you must also quarantine before booking lodging reservations. These new requirements are less about where you are from and more about where you have been and who you have been in contact with. For this reason, we want all guests to certify that they have been in the state for 14 days and that they have been symptom-free during that time. We hope these measures will act as a first step in getting our world-class lodging sector operating and creating those Vermont experiences and memories we are all missing right now, as well as we continue to work our way through this pandemic together. And with that, I will turn it over to Dr. Levine.
Good morning. I know we have a large queue in the press for questions and answers, so I will keep my comments brief this morning. They're going to relate to symptoms, testing, and treatment. The comment on symptoms, if I could bring your memory back to the slide Commissioner Pichek just showed regarding syndromic surveillance, the marked drop in activity for COVID-like symptoms. The part of the graph you didn't look at was there was a very zero-level growth of influenza in the state. For several weeks now, we have not had any influenza. So if you're reporting symptoms that you think might be the flu and saying, I'll get over it, what have you, you may want to be interested in getting tested for COVID because there is no flu essentially in the state. Second item has to do with testing, and I'm only mentioning it because of the news in the last couple of days from the Food and Drug Administration regarding the Abbott instruments. These instruments I've talked about at previous conferences. They're called point of care, so that you would go in, have your nasal specimen taken, and then within 20 minutes have a result. We obtained 15 machines from the federal government, and we're literally at the moment of deploying them across many of our healthcare facilities across the state. However, the FDA did come out with not necessarily a recall or anything, but a concern stated that the accuracy of these tests, particularly the higher false negative rate, was of concern, and that they were actively working with the company and studying that further. We did not feel this is the optimal time to deploy these instruments, so I'm just putting that out there now. And in phone calls with leadership across the country, across the state of our healthcare facilities, there's widespread agreement with our being cautious on those. Lastly, I'm talking about treatment, and the only treatment that we really have to talk about is the drug remdesivir. The FDA just in the last less than a week has put out an emergency use authorization for this investigational antiviral drug for the treatment of suspected or laboratory confirmed COVID-19 in adults and children who are hospitalized with severe disease. In this case, severe disease really reflects low oxygen levels, being in an ICU and on a ventilator, or requiring other extraordinary means of support, and certainly requiring oxygen support. The limitations of the drug are that it is not advised in younger children or in pregnant women. It's really an investigational drug still. However, there is ongoing research showing that it perhaps reduces the duration of symptoms, though it did not have an effect on survival, though the small number of patients may have precluded that from becoming evident. This emergency use authorization allows the drug to be distributed in the U.S. and administered intravenously by healthcare clinicians as appropriate to treat suspected or laboratory confirmed cases. We've received our first shipment. We're on the verge of getting the second shipment. I can tell you that the quantity we've received will already treat far more than the number of patients that are currently in our hospitals with COVID-19, and it will be available for use as an investigational drug when it's felt to be appropriate by the healthcare community. And with that, I'll turn it over to Rebecca.
All right, as some of the speakers have mentioned, we have our longest queue yet with 28 people waiting to ask questions. It is 11:35, so please, I encourage the questioners to keep to their question and listen to other questions to ensure we're not doubling up. We're going to start with Calvin.
All right, thank you. So this is probably a question for Secretary Hurley. So you said that launching accommodations, including campgrounds, can open up on May 22nd, but the state parks have canceled reservations until June 25th. They announced that earlier this week. I guess can you just offer some clarification?
So I probably would maybe be a better question for Secretary Moore of ANR, who's, I'm not sure if she's on the phone. Okay. Secretary Moore? Yes.
Sure. Yes, thank you, Calvin, for that question. We are in the process of staffing up for state parks and working as quickly as we can to ready them for opening, trying to help Vermonters and other guests plan. We took the step of canceling reservations through the 25th of June, as we have a high degree of confidence of being able to have the full system open by June 26th. We are also working to see what steps can be taken to ready and open some of our parks sooner, but that remains very much a work in progress.
And then just a quick follow-up question as well. On June 15th, people, or up until June 15th, people won't have to prove the 2-week quarantine period. According to the guidance, I guess, is there an expectation that people won't have to do a 2-week quarantine period after June 15th?
Well, that's to be determined at this point in time. Throughout the state of emergency that we extended to June 15th, obviously they'll have to conform to the standards we put into place, and that'll be determined over the next month or so. And we'll just have to watch the data and the science to see if that's necessary after June 15th.
Stuart?
Governor, could you share your views about the desirability of revoting school budgets? What is the objective of that proposal?
Well, I'm not sure. Let's get back to the root of the question, I think, is what do we do with a $170 million hole we have in the education fund, and what do we do about the potential $300 to $500 million hole we have in our budget to the tune of over $500 million when we combine that. We were asked to come in to the legislature yesterday to present in a brainstorming, what they termed as a brainstorming session, to present ideas on what we could do to close the budget gap in education, which is about $170 million. Knowing that it's a bit different than the general fund and other funds that we have in the legislature, where we can actually do them by legislative action. This is a little bit different because what happens with the education fund is all the districts combine and they send in their budgets, and then when that's all accumulated, then the legislature just determines with our input what to do then in terms of how do you fill the bucket and how do you pay all the bills that are coming in. A lot's changed over the last few months, and again, now we're projecting due to lost revenue in purchase or sales taxes and so forth, that we have this $170 million budget in front of us, or a gap in the budget. So what transpired was a brainstorming session, and here's one way of doing this. While many are talking about how do we increase taxes, what are we going to do? Are we going to allow property taxes to go up by 20 to 25 cents per hundred, and to gain this $170 million? We put on the table, well, we should be talking about how do we reduce spending at the same time. I mean, it's a $1.8 billion budget in education. We need to, as we're going to have to do, these are going to be difficult decisions to make as we move forward, but we're going to have to look at the spending side. We have to. It's not just about revenue. I think I agree with many who say, Vermonters are tapped out. They were tapped out before the pandemic, and this hasn't made it any easier for them. So raising taxes, which should be a last resort. What are we going to do? So we're going to have to do this in the overall budget in state government, and it was just an idea that we presented in terms of let's look at the spending side.
Should we wait for potentially the next stimulus from Washington, which could address this?
Potentially it could. The next stimulus package that is being proposed could help fill some of those gaps, but we don't have the luxury of knowing what they're going to do. So that we have to put some of these ideas on the table as for instance, what if they don't? And then where are we going to go from there? So again, all ideas on the table. We want to work together. We're right in the middle of this emergency. We're working our way out at this point in time, but some of these issues are going to start coming up because of the economic concerns throughout the state.
On the child care front, Governor, the guidelines have come out from the administration, and we've gotten a lot of correspondence from at least a vocal part of the segment, and they're saying that these won't work for them. That it's too difficult to I guess
Open
go
back up.
along with that to be able to open up. On the other hand, I've also received word from some that think they can do it, but are confused about the mask requirement for staff. Whether if there's times when the staff can take their mask off to do some work and such.
I may let Secretary Smith or Commissioner Levine answer that.
Thanks for the question. First, let me just reset this whole discussion, because I think it's important that we talk about where we've been and where we're going on the child care opening front. First, we have, as you just heard, the lowest spread rate in the country. I mean, that is incredible, and you've got to thank Vermonters for everything that we've done, and I really appreciate it. Second, just remember, when this pandemic hit, we made the decision to close child care centers, and we put in place a structure and payment plan designed to keep child care centers financially viable throughout the height of this crisis. In fact, if you look at some of the publications nationally, this program has been lauded throughout the country as one of the best responses to child care. It is something that I think we can be proud of as Vermonters. It was important to keep our child care centers intact financially during this crisis because, one, for the children, and then number two is when we came to this point of restarting, it was important that we have a viable system in place. Now, from what I've heard, and I've heard some of the same things that you have, from what I've heard, there are three general grievances from some, and I want to be specific here, it's some, that about restarting childcare. First, supplies and PPE and those sort of things being in that. The second is finances in terms of what's going on, and the third is health. Let me just address the first two, and then I'll bring in Dr. Levine to address the last one in terms of health. The complaint that I'm hearing is the availability of cleaning supplies. And I have worked with the industry, the child care industry, and have said that we will work with the state EOC, Emergency Operations Center, during this to help them buy bulk supplies, and we'll try to figure out a distribution system to make sure that they have the cleaning supplies that they need. And second, under the category of the extent under finance, there were two issues under there. And by the way, on personal protection, we will work with them to make sure gloves and cloth masks in particular. And we can work with them through the health department on the guidance of when, what the specific procedures are on that. With the category of what I would say is finance, the restart grants, or whatever you want to call them, we will extend those to July 6th. That's what people wanted. There is also flexibility in the call for the payment process. Before the pandemic, we reimbursed on an attendance basis. During the shutdown, we changed that and reimbursed on an enrollment basis to put some flexibility into the system and to make sure that the financial certainty and stability in the program was there. Now that we're going back to opening back up again, we're going back to the attendance system, which puts more flexibility on the parents, sort of the payment to the parents in order to make sure. But I have said to the industry, if we have to require some more flexibility during this transition, this 30-day transition, given the fact that it'll be a month, we will certainly work with them to provide that transition. So what we're trying to do is address all those concerns. And on the safety side, I'll ask Dr. Levine to sort of weigh in on that.
Thank you. And just briefly, every step of the way, whether we're dealing with childcare or any other sector, the words health and safety and well-being are always used. And for this sector, they're paramount. And the health department is quite confident when we look at all of our partners, if you will, when we look at guidance from the Centers for Disease Control and Prevention and their recommendations, all recommendations align with those. We look at abundant community partners, including but not limited to pediatricians across the state, Building Bright Futures, Let's Grow Kids. Comprehensive input has come from all of these sectors into the guidance that we've provided. And in the end, again, it's all about protecting health and safety and well-being. In fact, a lot of our child care organizations nationwide are actually drawing on the Vermont guidance as a stellar example. And the decision to reopen is really, as the governor has stated so many times, driven by the data, driven by epidemiology, driven by the fact that we at this point have such a very low rate of spread of virus. And we have a strong public health system in place to contain future outbreaks. We need to look at the impact the virus could have under all these safety measures and compare it to the alternative of not opening, and what would be the emotional and developmental impact of isolation for our children, and particularly our most vulnerable children. And we really do feel that the equation is far more balanced on the side of protecting our children in that way, and by child care being a significant contributor to their development. And the Department of Health is there to support and provide technical assistance for all child care providers as needed, with a direct phone line and support staff for them. Thank you.
All right, moving to the phones, starting with Sean from the Chester Telegraph.
Thank you. This is a question for Governor Scott. Following on the question about the House and Ways and Means Committee yesterday, around 80% of the cost of education is salaries and benefits, which are mostly under contract. And on Monday, with regard to a question I had about out-of-state road workers, you said a contract is a contract. So if that's the case, where do you see savings coming from when 20%, that additional 20% includes things like heat, lights, transportation? And also, during the hearing, Secretary French spoke of a broader contraction of our infrastructure. And I'm wondering if this is kind of a first step toward the blueprint forming Vermont's education system that envisions doing away with local control.
I'll let Secretary French answer part of that question, but in response to that, I just want to remind everyone who has gone through this pandemic is going to be impacted in some way. Each of us individually, those businesses, the restaurants and all the businesses that are still shut down today are going to be impacted. They aren't going to be made whole. And I don't believe that any of us, whether it's in our budget, the $400 million hole in our budget, that's not going to be fulfilled by magic. This $170 million hole in the education fund isn't going to magically appear unless, of course, there's congressional action that would provide the funds to do so. So if that doesn't happen, we have to take action in some way. We decided we need to come to the table. It didn't seem as though anyone was talking about the spending side. This is a $1.8 billion initiative, one of the largest expenditures in state government. And we thought it was necessary to have the conversation about what do we do next. We can't, again, we're not going to spend our way out of this. We're not going to tax our way out of this. We have to come up with other alternatives. And I don't know what they are, but we have to have the conversation. So this was a starting point. It was a brainstorming session, and it's something that I think is necessary this is just one step. This is just the education fund. We're going to have these conversations as we move forward throughout this legislative session. The first 3 months is going to be a reduced budget of some sort, and then we're going to reflect on what we're seeing. And the sooner we put people back to work, the sooner the economy, when it's safe, the sooner we can get the revenue coming back into the coffers, the better off we're going to be. But in the meantime, we have to plan for the worst. So we just came forward with a concept that we hadn't heard much about, which is how do we reduce spending? Secretary French?
Yes, good morning. Thank you for the question. No, it wasn't part of the blueprint concept, as the governor alluded to. This is really about wrestling with some really challenging dynamics relative to the financial situation. The better part of that conversation in the last couple of weeks has been focused on how to use the federal revenues, including the CARES Act revenues, to address the issue. And as we get further into that conversation, we're starting to understand some of the complexities and the limitations on the current funding that the federal government has sent our way. But in terms of the contract, you're right. I mean, 80% essentially of school district costs are in personnel, and it's hard to imagine how districts are going to navigate this context without addressing that issue. I will point out that this spring there were a large number of contracts open until very recently. My understanding that a lot of them have been settled. But our point was actually to respect local control and decision making and say, here's a new context that folks didn't really understand back when they were voting budgets. And one approach is certainly if we are going to address the spending side was to respect local control. And we think by giving voters that information, perhaps that might be one approach. So that would no doubt bring that conversation back to the local situation where, the labor contracts would be maybe reconsidered by locals or not. But I think it's, the governor said it's hard for us to imagine, I think to a certain extent, how we're going to navigate this without everyone putting their best thinking on the table. And that was the spirit in which we offered those suggestions yesterday.
Is the state going to give some sort of guidance on how local boards should break their contracts?
No, it's not a question about breaking contracts per se, but there's always a mechanism in the labor relationship to request the other side to go back to the table. And as you know, there's a lot of uncertainty right now in how we're navigating COVID-19. A lot of the contracts, most contracts actually include conditions of working conditions of labor, and those working conditions are changing dramatically as we reimagine how it will happen. So I just envision that there will be a lot of conversations along those lines. Not necessarily suggesting that necessitates a reopening of the contract, but I think our success in Vermont is based on that partnership with labor and management, and I think it's unrealistic to think those conversations aren't going to emerge as a result of the crisis.
Thank you.
Mike Donahue, the Islander.
Good morning. Work on replacing the state's only drawbridge between North Hero and Grand Isle resumed in recent days. And as I drove by the bridge yesterday, there were probably a dozen out-of-state trucks from Maine, New Hampshire, Massachusetts, New York. What steps were taken by the state to ensure that the out-of-state workers passed a 14-day self-quarantine? And where were they living during that time? And were there any were they given any kind of special treatment that other out-of-staters do not have to follow? And what are those special procedures that they may have been offered, if there were any?
Yeah, there are now guidelines in terms of those who are working in the state. Those guidelines must be followed. They were, I believe, this is probably a better question for Secretary Flynn, who's not on the line, I don't believe, but they were informed that they had, when they came back into the state, that there was a quarantine period. I believe he might have asked them to be tested before they came as well. They had to go through a rigorous safety initiative to follow and sign off on, and they have to adhere to while on site and containing in some way. But I don't have the specifics, but we can certainly get that to you.
And so there was some special treatment. Has that been offered to other out-of-state workers, as far as you know, and or will it be offered to other out-of-state construction crews and paving crews and others that have contracts?
Yeah, the same guidelines go for all the contracts in the state, as well as municipalities that might have infrastructure repairs and water, sewer, and so forth. So there are guidelines in place that Public Safety has, I believe, on their website, and everyone is adhering to those.
The Secretary Flynn will be able to get to us with additional information.
We will contact Secretary Flynn and ask him to get in contact with you.
Great. Thank you very much.
Tim McQuiston, Vermont Business Magazine.
Hi, this is for Michael Harrington. And I was wondering about the unemployment insurance. You released a lot of data recently, and I was, just wanted to be clear about whether the PUA people are being counted as part of the labor force and in all those unemployment statistics that you're accumulating, and when you release the unemployment rate next week.
Yes, thank you for the question. So I want to hit on a couple different things and run through some of the numbers for you here. To answer your question, the PUA numbers, everybody is filling out an initial application form. The PUA numbers, at this time, I'm not sure whether they will be included specifically or separate in the numbers we provide to the federal government. That's the question for our labor market economists. I do want to hit on a couple of different points. So just so the public is aware, as of yesterday, May 14th, the Department of Labor has received roughly 90,213 initial claims. Of those, 63,443 are eligible for regular UI benefits, and 25,361 are eligible to file under PUA. Also, as of yesterday, we have over 68,000 individuals being paid, and that includes about 56,000 people under UI and about 12,000 people under PUA. And we paid out over $50 million to PUA claimants in the past few weeks. Important to remember that as we slowly open the economy and more individuals go back to work, the number of individuals filing for benefits will also decrease. I know there's been a lot of question around that, but we still include those numbers in our initial claims. So it's possible for our initial claims numbers to stay steady or increase while weekly filings actually will go down. And so there will be a difference there between those two numbers. In terms of our call center volume, I want to take this opportunity to note that we've seen some really great positive trends. At a high point, I believe we reported over 500,000 call attempts onto our various lines in one day. 2 weeks ago, we were at 60,000 call attempts, and as of yesterday, we were down to about 5,400 attempts, 75% of which were able to be answered. So that does not count unique callers. The unique callers are much less than that, obviously, but we have over 250 people on the line that are able to answer about 4,500 calls per day. There are also a lot of questions about pandemic unemployment emergency compensation, or PEUC. It's also known as extended benefits. And I just want to hit for a second on that. This allows regular unemployed claimants who have exhausted their 26 weeks of benefits to become eligible for an additional 13 weeks. I know there are about 1,500 people out there who are waiting for the PEUC program to roll out. We're in the final stages of development. We hope to deploy that next week. And I just want to let the public know that once that happens, there are two things that will happen. Once the process is finalized and these people are put into the PEUC program, we will post a red banner across our website So if people want to check on a daily basis or multiple times in a day when that program is live, a red banner will appear for them that will tell them what to do for next steps. But also, if they are eligible for PEUC, all those claimants will also receive a letter in the mail informing them of next steps. So I thank you for giving me the opportunity to just hit on some of those numbers. Does that answer all of the question that you had?
The other part, I know there was an overpayment glitch on the PUA. When do you anticipate that will be all set? And also, do you anticipate the UI trust fund running out at any point? It's just under $400 million right now. How is that looking?
So with the payment piece, we've been able to pay. So the people who were truly impacted by that in the longer term were people who were paid and submitted a claim prior to May 1st. They received an extra $1,200. And so we are working through that process, and those people will actually start to begin to receive benefit checks by the next step of benefit checks by early next week. Most of those people received a couple weeks ago pay for actually 4, 5, and 6 weeks at one time because they were filing for back weeks. And they will be caught up and start receiving additional benefit checks by next week. If for people who filed after May 1st, we have actually already started paying those individuals as early as Tuesday and Wednesday this week. We paid a significant portion of those individuals yesterday, and we'll continue to pay those as claims go through the system. So most of that calculation issue that we ran into has been resolved, and the only people that are still waiting out there have already received some PUA payments, and the next step in their PUA payments will be issued next week. With regards to the trust fund, I think it's always going to be a question of how long does this last and how long do we continue to draw on that, and how many individuals are able to return to work under safe conditions and stop drawing unemployment insurance benefits. Prior to COVID-19, we had one of, if not the healthiest trust funds in the country. And so we are still in relatively good shape. There are already other states that have started to borrow money from the federal government. But I think it really depends on how long this extends for, and what is the ability for employers to continue to contribute to the fund going forward. So it remains to be seen. We are still in a relatively healthy condition, but again, the length of this pandemic and disruption will really determine the outcome.
So you're not anticipating it running out under current conditions then?
Again, it's hard to say. We're not going to run out in the next week or two or month. And if we do get to a point where we are close to running out, we will borrow, as we did during the last recession from the federal government. But it really depends as claimants continue to file each week, but also contributions to the account, federal reimbursements to the account, interest on the account, all play into money going into the account while money is also being paid out in benefits. So there really is not a way to model the long term. We know if everything were to stay consistent or constant, what our timeline would look like. But that fluctuates with a number of different variables each and every day.
Tim, bottom line is it's too early to tell, and we'll just have to monitor this as we move forward.
All right, great. Thank you, Governor. Thank you, Michael.
Thank you.
All right, Avery, WCAX.
My question is for Secretary Curley. So what kind of activity is the state expecting with the easing up of these lodging guidelines? Do you expect Vermonters to be utilizing these lodging businesses, or do you think out-of-state visitors will come, quarantine somewhere else for 14 days, and then maybe start a vacation or a stay?
It's really hard to tell. I think right now we're hoping to encourage Vermonters to support each other by, if they have the ability to take a staycation, that they will do that. But certainly there may be people who down the road want to finish out a quarantine with a family member who lives in Vermont, and then ultimately stay at one of our lodging properties. So it's very early to tell, but Right now, we really just want to get things moving and get the lodging industry and the camping and the marinas and whatnot rolling.
Okay, thank you.
Chris Roy, Newport Daily Express.
Yes, good morning. Thank you. I'm just wondering if there's any indication when you think the 14-day quarantine requirement will be over. And along with that, Vermonters who go over to New Hampshire for short trips, like over the Dartmouth-Hitchcock Medical Center, expected to quarantine when they return to the state? Thanks.
Yeah, in terms of the second half of the question, those who go for appointments or shopping and so forth, or visit family members back and forth across the border, they are not expected to quarantine for the 14 days. In terms of how long, tough to say. At this point in time, we're continuing to advocate for that, but I'd let maybe Dr. Levine answer that a little bit further.
It goes back to a line that we use commonly at these press conferences, which is we're going to look at the data, and we're going to make sure that we do the right thing to protect Vermont and Vermonters. We know the prevalence of disease, the percent positivity of tests in other states. The governors often refer to the number of deaths in some of these states that is ongoing at this point in time. So I do believe for the foreseeable future, things are going to stay the way they are. But obviously with everything about this epidemic, things that cross state borders concern us, but there may be a time they don't concern us. And we'll just watch the data and be very careful and make sure that we do the right thing.
Okay, thank you.
Greg, the County Courier.
Hi, Governor. I'm not sure if this is completely for the governor or also for Secretary Curley. With the state reopening the hospitality business, whether it's a 25% capacity or 14-day quarantine periods or whatever safety measures each one has to follow and how that may change, with the state not registering or requiring registrations of short-term rentals like Airbnbs, how will the state ensure that those are going to be held to the same standard as hotels and motels, bed and breakfasts that are required to register? And has that changed your view, Governor, on whether short-term rentals should be required to register by the state?
The second half of the question I'll answer first. Again, I think you'll find all that laid out in the guidelines. I'll let Secretary Curley answer the first part of the question. And in the second half, that's to be determined. We'll learn a lot from this situation that we find ourselves in the postmortem. We'll be looking at what we did well, what we did we could use some help on, and do something different in the future, and learn from this. I would expect this will come up in the future with the legislature, but at this point in time, we're comfortable with where we're at, and we'll continue just to try and keep people safe.
Yes, so to speak about lodging industries and Airbnbs and broadly private rentals, it's not a perfect system. We have put online a certification that all lodging and campgrounds and marinas can use. We're asking folks to do it and to do it on their own as well. We hope that down the road the quarantine will get shorter. Dr. Levine might be able to talk about that, but right now it's the best we have, and we would just say that if we're successful in doing this, we'll be able to open the lodging sector up more broadly, as well as open other aspects of our economy. And so I would just encourage folks to think about the people around them and to comply, because the sooner we get this right, the better chance we have of getting things opened up.
So am I understanding it right that for Airbnbs and other short-term non-registered facilities, that it would really just be based on the honor system?
Well, it could be on the honor system. Obviously, keep in mind, Vermonters are definitely looking around and seeing what's going on in their neighborhoods and in their communities. So If we learn that there's some questionable activities, we certainly will try to reach out and educate them and do what we can to help people comply on their own. But you're correct. I mean, right now we don't want to have to think about, strong enforcement of this. We really believe in people and that they have the ability to get this right.
Secretary Sherling, or Commissioner Sherling, you're also on the line, right? I know your team had worked on some efforts for all types of lodging facilities on the way down. So maybe you could just speak to how that might apply on the way up.
Certainly, I think we've broadly seen compliance, as has been highlighted throughout this call, and that's why the state is in the position it's in now, with the ability to turn the spigot and for the governor to make decisions to be able to reopen a phase at a time. We expect the same is going to continue. As Secretary Curley highlighted, the more compliance there is, the greater chance that we're going to be in a position to really open things up a little bit more sequentially over time. So Vermonters have really complied really well. There is a compliance reporting tool available, but in the grand scheme of the last 2 months, it has been used pretty lightly.
Thank you, Secretary. Thanks, Governor.
All right, Aaron, BT Digger.
I have a question about remdesivir, so that's probably for Levine.
Most definitely.
I wanted to know if the drug would be distributed to individual hospitals or kept by the state and then given out as needed, and whether there'll be a statewide standard for when it's given out or not.
Sure. So the initial shipment was indeed delivered to the refrigerator at the Department of Health. It has to be kept under special conditions, but that's the last time we wanted to see it, actually. I really want this drug to be at the point of care, so it's available when and if it's needed by a patient and their healthcare provider. So the bottom line is we've been working intensively with the medical centers across the state and with the Association for Hospitals, VAHS, to make sure that we can work out that distribution system, as well as really hone in on those criteria that make it indicated for a particular patient's use. And because it's an investigational drug, also need to explore the use of investigational drugs with certain levels of oversight panels, like institutional review boards that commonly come into play at those times. So we want it to be available to any hospital that needs to have it, and that's the system we're working out right now. But most assuredly, it will be stored at hospitals as we move into the future and not at the health department.
Okay, so those oversight panels or groups or whatever, that would be kind of at a statewide level. So there's one statewide standard or guidance.
That's more in terms of ethical principles regarding investigation and investigative drugs. So it would be more at the institution level. And we're very comfortable with that. Those processes are in place for a whole bunch of reasons in hospitals all the time. Like I said, this is really meant to be available to those who need it, and as long as there's equity and the distribution across the state, and that where it's indicated it could be used for a particular patient, we're very comfortable with that. We don't want to get in the way of that process.
Mm-hmm. There's also some research that the drug could be best used early on when someone has symptoms, yet the FDA has specifically, suggested it be used or guidance says it be used for severe cases. Are you considering that when you discuss these guidelines and how the drug is distributed and used?
Right now, we're abiding by the guidelines that the emergency use authorization provided for, which is for really the sicker end of the disease spectrum, and essentially anyone who qualifies to be admitted to a hospital because their disease is at that level of severity. And even there, as I kind of implied in my comments, we don't have a lot of clinical trials that are peer-reviewed and published to rely on. We have experience in very early trials that looked favorable. And since there really is a vacuum in available treatments for people with severe COVID, the intent was to get this out there easily. If you were at an earlier stage of disease, presumably you wouldn't be in a hospital, and there's already an impediment to your getting the drug because it's only administered intravenously. It's not a pill. So you'd have to be in a setting where you could get it by that way on a repetitive basis, but still not be sick enough to get into a hospital. So I'm sure there are trials going on a more national level to look at the question you're asking, but none of them are at the point where we would want to use the drug for an earlier stage of disease, if you will.
Thank you.
Taylor, Channel 7 News.
Can you hear me?
Ken.
All right, so my question is kind of directed more toward Dan French, but I'm wondering if you know at the Vermont level, if we'll know if students with kind of maybe more significant learning disabilities or mentally handicapped will be able to have any in-person summer school services, those that really thrive off things like speech therapy and things of that nature that are really hands-on in person?
Secretary French?
Yes, thank you for your question. Yeah, it's certainly something on the forefront of our planning as going forward. We're certainly, working very closely with the Department of Health right now to understand, what the public health situation would be in the summer as best we can. But certainly we are thinking about how to solve this issue for our most vulnerable students.
Great. Thank you.
John Dillon, VPR.
Thank you. A question about testing. You mentioned concerns about the Abbott test, but does the state have sufficient conventional testing to do? And if so, would you implement universal testing in prisons and nursing homes? The latter being where people have been, where most people have gotten sick and died of this disease.
I'll ask Secretary Smith to answer that.
John, thank you for the question. Where we're headed is, like I said the other day, is anybody that wants a test will get a test. And as you can see in the pop-ups, that is the strategy that we're using. And we're going to be expanding that as we can to make sure that tests are available to not only those that have symptoms, but those that are asymptomatic as well. These policies evolve as we move forward. For example, if you remember, we're sort of ahead of our times nationally in the first part of April, where we said if we have one positive within an institution, whether it's a nursing, whether it's a long-term care facility, or if it's a correctional facility, we will test the entire facility, which we have done. So people that were asymptomatic in those sort of situations were tested starting in the beginning of April, and I can't remember the specific date on that. We have started offering that now to the public, and we're revisiting our original plans in terms of what we announced on April. For example, we started what I called the hunt. Other people call it boxing in strategy at Chittenden Regional Correctional Facility, and what we decided to do was to go in and on a voluntary basis test staff, and we did find a positive in that test that resulted in the entire facility being tested. That resulted in zero more positives in that facility. Next week, or I don't know when it's specifically scheduled, but we are scheduled to go to St. Johnsbury, where we will test both inmates and staff at that facility. And then this policy is going to start to evolve where everybody will have the availability of tests. In terms of long-term care facilities, and I'll let Dr. Levine talk to this a little bit, we started, as you remember, in April, again, we started, if there was one case, we were testing the whole facility. And not only that, those residents where there were those that were elderly, we were doing that. And we were very liberal in how we tested. For example, we tested the Veterans Home, even though there hadn't been a recent case. We tested the Veterans Home, and we've been very liberal in how we're doing that. I can say that the policy today is if a long-term care facility wants a test, they can get a test facility-wide. Not only can they get a test, we're doing a pilot project, and I'll let Dr. Levine talk about it because I'll get too far down the road and get myself in trouble, but we're doing a pilot test with the CDC where we'll do multiple day testing within a long-term care facility just to make sure that we snuff out any sort of virus in that facility, well, COVID-19 virus in that facility. But I'll turn it over to Dr. Levine. This has been evolving as we've gone, just so let's put this in perspective, and it's thanks to a lot of people, including the governor, making a lot of effort to get our capability of tests up and where it is today. But we've gone from having almost run out of test capacity to today where we can test at will just about anybody that wishes to have a test. And we're continuing that strategy as we move forward. I'll let Dr. Levine talk about long-term care.
Thank you, Secretary Smith. I'll try not to be redundant and just make some points that may not have been made yet. Obviously, long-term care facility inhabitants and correctional facility residents are amongst the most vulnerable, if you categorize them in that way. And they should be priority populations for testing whenever needed. If you look at current guidance nationally, and specifically from the CDC, it doesn't actually advocate for mass testing in such facilities in patients who don't exhibit symptoms. However, we have, from the very start, been very, very aggressive in our approach to these. We started at an incredibly early time with restricting visitation, at a time when that wasn't being done universally. We then moved to the assessment of staff with symptom checking, with thermometer testing, etc. And there are states now that are, frankly, quite severely afflicted by COVID that have made recent policy changes to just test all the inhabitants and all of the staff at these institutions on an ongoing basis. I want to make clear that that's their decision and not in response to any changing public health guidance that we're not abiding by. We're, in fact, as Secretary Smith advocated, working aggressively on a protocol with the CDC that's quite novel, and they're regarding as a pilot, but we're regarding as a necessary protocol based on our experience in Vermont. And that really has to deal with where does an infection come from if it's in one of these larger facilities? It comes from the outside, sometimes through staff, but as we've learned the hard way actually, sometimes through new admissions to those facilities, whether that would be someone in corrections or somebody in a nursing home facility. So that we really want to focus on that population, and basically we are focusing on them and requiring testing of them on the way in, requiring quarantine as if they were positive on the way in until we are assured that they are negative over the appropriate number of days. And as the Secretary alluded to, that requires a multiple testing regimen for those individuals. We also have a pilot and protocol in place that deals with rapid intensive management of infection in facilities that already are known to have a positive in either the staff or the patients, and we will continue with that. Fortunately, we have numerous experiences testing facilities widely in the setting of a positive and are heartened by the fact that we've essentially not seen facility-wide spread in quite a long time. We have the 2 nursing homes that we've talked about here previously in Burlington that were more severely affected and had a significant mortality presence in them. And since that time, knock on wood, we've done very, very well with our surveillance and intervention capacities that we've abided by. We're currently, as you've seen in our presentation today, in a state that has very low prevalence of disease, and our understanding of this is being confirmed by some of the testing we're now doing in a less symptomatic population, because they are not turning out to be a reservoir of infection that could perhaps spread through the population. In fact, they're turning out to not have positive tests. We have an aggressive outbreak response team strategy should we ever have to use that again in any kind of long-term care facility. We have kept facility-wide testing for facilities that haven't been affected with a positive voluntary on their part, but have never declined for sure. And now, as you've heard in our Department of Corrections, it is a policy that we will be testing those as we go along on the schedule that's being outlined. Does all that cover your question well?
It does indeed. Just a very quick one, and apologies if I should know this, but what's the turnaround on between test and result currently in Vermont?
Yes, so at the best, it's less than 24 hours, and pretty much at the worst now, it's 48 hours. So we're no longer having 4 or 5 day turnarounds that you may have heard about very early in our experience. And we hope that it will maintain that kind of window that I just described.
Thank you.
John, I wanted to answer another part of the question. You asked about inventory of testing supplies, and we have an emergency operations center briefing every single day. I think, I don't know as I've missed one since early March, but give the inventory on a daily basis, and we have tens of thousands of testing supplies available today. So we feel comfortable in that, but we monitor it on a daily basis.
Thanks again.
All right, Lisa, the AP.
Thanks. This might be a question for Secretary Curley. Is there a time frame for when the capacity would be expanded at lodging facilities, given the summer tourism industry and weddings and things? And is that a matter of weeks or months?
Again, Lisa, I'm going to answer part of that. We're going to, I know I keep repeating this, we're going to watch the science and the data and try and determine when we can open things up a bit more. Suffice it to say, I mean, I've talked about this a lot. We're managing this. We're doing it incrementally. We're going 25% in a lot of different categories. And our hope is that as soon as we can confirm that we're moving in the right direction and we're not causing harm to anyone within the state, that we'll continue to open that up. So we'll go from like 25% to 50% and then go further until we get to 100%. So how long that takes is anyone's guess, but we're hoping sooner rather than later. And again, our experience has been, we've been having some great numbers. We've done the right things through the sacrifices of Vermonters. And so we benefit from that. And our hope is, again, to watch the data and open it up just as quick as we possibly can.
Thank you.
Joe, Barton Chronicle.
Well, I've got a question from a reader, and it probably relates to the answer that Dr. Levine just gave. He hasn't seen his father, who is in a long care facility for 2 months, and he is wondering whether anyone has any idea of when and how that might change.
Again, I'm going to let Dr. Levine answer that, but that is a question that we ask ourselves. In fact, I brought it up this morning because I have a great amount of sympathy and empathy for those who are in those long-term care facilities. They want to see their their kids, their family. So it's on the table. We're trying to determine a safe way to do that. But Dr. Levine.
And as a physician who used to periodically round in those facilities, I'm very sensitive to the fact that it can be very lonely if you're not able to see your family or don't even have family, and you live in those facilities. So that topic has come up. We feel heartened by the fact that the Department of Disability, Aging, and Independent Learning just sponsored a Ben & Jerry's Mother's Day experience for everyone living there, which I'm told went very well. Somehow I wasn't included, but at the same time, we were so sensitive to the fact that it has been an isolating environment. And the staff are all aware of this too, and it's clearly the furthest thing that they want to see as well for the welfare of the patients they care for. We have now convened a working group, not just within state government, but with some community partners as well, because we really do want to try to do the right thing. And again, just like what we're doing with Reopening Vermont, it does have to be phased. It does have to be deliberated about for a period of time, and all the cautions that are appropriate being put into place. But we are trying to capitalize on the fact that the weather is getting nice, that the weather is getting warm, that there may be some opportunities, even if it's within a doorway, to at least visually see and hear from your loved ones, even if we can't put them in the room with you that moment. So we're trying to figure out ways that we can make this work and that will be, from a public health standpoint, still protective and work operationally within the kinds of facilities we're talking about. So it's really at the top of our list of things to look at, but I can't give you the final word just yet. We want to be very careful with this. Because again, we've done so well in Vermont with all of our facilities, and we don't want to unintentionally introduce a factor that would disturb that wellness that we've established.
Thank you very much.
And I would just add, again, I don't think there's a sector, a population that's been impacted more by this pandemic, and just want you all to know that we haven't forgot about you, and we're trying to protect you, but at the same time, we understand you want to see your family, so we're trying to make that happen in a safe manner.
All right, thank you to everyone. Just a quick gut check. We are 1 hour into the question and answer portion, and we are halfway through our list of 28, so 14 more to go. Todd, Caledonia Record.
Am I on?
You are.
Sorry about that. I thought I disconnected. What guidance do you have for local kids organizations that normally start around this time, such as 4-H clubs, Boy Scouts, Girl Scouts, maybe recreation department, music groups, that kind of thing?
I'm going to look at maybe Secretary Smith, but keep in mind the population, the aggregate number of people in a gathering is 10 at this point.
Yeah, so we are working right now. I know you didn't specifically say camps, but we're definitely working on guidance, and we're expecting some proposals very shortly that will help with that. I think it will also start to help guide our conversations and thoughts about recreation and broadening, the offerings. So again, I think you heard the governor speak this morning that, even just now, that we're looking, hopefully if things continue to go well, to broaden to 25, and it really will enable people to get creative and do some of the things they're really missing without putting others at risk. So more to come on that. I'm going to hand this over to Secretary Smith.
Just to make sure that everyone knows, when we issued the guidance for child care centers, that included those regulated day camps as well. So those regulations, those guidelines have been already issued with those regulated day camps that are out there.
I guess what I'm referring to is like the meeting of the local Cub Scout pack, like the 6 or 7 kids?
Yeah.
Can they still get together
Right.
at the dead mother's house?
I don't know as we're precluded. I mean, I would put that under the category of recreation. We've said that we've opened up recreation to those under 10 in numbers, non-contact and so forth, remaining, the social separation and so forth. But as long as they adhere to the guidelines, they can meet in groups of less than 10.
Great, thank you very much.
Elizabeth Murray, Burlington Free Press.
Yeah, hi. My question has to do with the relaxation of the stay home, stay safe order. I just wondered, what are Vermonters now able to do that they weren't able to do before under that order?
Well, yeah, again, we took if you take out half the equation, the stay home, stay safe, we took out the stay home portion. While we're providing guidance, we're asking people to stay close to home. You can get out more now, and it doesn't preclude you from doing that. So it's now just the be smart, stay safe mode, and we hope that people will adhere to that and limit their travel as much as possible in their interaction with others. And I think it's important when you do interact, if you can keep track of who they are in case we have an outbreak, that we're able to trace that back.
Okay, thank you.
Neil, the Vermont Standard.
Hello. My question is about the new way that the coronavirus is presenting in kids. Is there any concern about that becoming a larger problem in Vermont with the opening of child care centers and day camps?
I'm going to answer it intelligently, but I'm also going to give you the caveat that I wish I could answer it more intelligently. This is a syndrome that has been described literally in the last few weeks. There's now a case definition that has been provided to us within the last number of days. Has to do with the symptoms, has to do with associating it with COVID, either by a positive PCR test, a positive serology test, or more contact with a COVID-positive person. We're learning a little bit more about the spectrum of symptoms and disease that it causes. But the bottom line is it's been reported not very often across an entire country that has, obviously now we're at the level of I can't even remember how many thousands of cases that the country has at this point in time. So the bottom line is we are concerned about it, but we're not paralyzed by it or overly concerned because we just don't have sufficient cases right now. And since it's such a rare outcome of cases, I wouldn't anticipate we would see such a rare condition with a very, very low level of illness right now in the population. Obviously, if that level of illness increases, we need to be surveillant and on the lookout for it. But the medical community at large knows what to look for now and understands it better from the standpoint of characterizing it in a case definition. So I don't think anyone would miss it, and they would pick up on it pretty quickly.
Okay, thank you very much. I appreciate it.
Thank you. Brittany, Local 22.
Governor, you mentioned that with continued improvements, hopefully we can see businesses like hair salons open by June 1st. I'm wondering if that next order would also include nail salons, and what about people looking to go to the dentist or see their eye doctor, those other close contact services?
Yeah, we're looking at the full gamut over the next couple of weeks. I think you'll find next week, if we continue to move forward in the manner that we have been, we'll be taking that next turn of the spigot. That will include some of those contact businesses, but we haven't determined which ones at this point, but hair salons are one piece of that I can say that we're going to move forward with. In terms of the dentist, I think I'm going to ask Secretary Smith to answer that.
Okay, thank you.
In terms of the dentist, I will say this has been a challenge because we're trying to get the dentists and everyone to agree on what the guidelines will be. As you know, we issued general guidelines last week on outpatient facilities, including outpatient surgery and clinics. We are and we said during that time, dentists and other clinicians will be sector specific. We are trying to work with the dentists now to try to get a cohesive set of guidelines that we can all agree on, and that has taken longer than certainly I expected. But as soon as we can get to that level where we can get agreement, and agreement is not just with dentists, it's got to be with the dental hygienists, it's got to be with a whole spectrum of people that make up that office through the Office of Professional Regulation, who's out of the Secretary of State's office, and through what is called, I think it's the Board of Dental Examiners. We are trying to get a consensus on what that sector-specific guidance is right now. But I want to say, because I've heard this a couple of times, if you're getting notified by a dentist that they'll be open on Monday, that is premature. Those sector-specific guidance has not been issued, and it has to be approved by the Commissioner of Health. That has not happened yet. I would just caution dentists who are telling their patients that they will be open Monday to be very, very careful on that, because the requirement of specific sector guidance has not been issued. And Dr. Levine, do you have any other thing on dentists? Okay.
All right. Rick,
Thank
Valley
you.
News.
Yes, thanks. I guess this is for Commissioner Levine or Secretary Smith. You said earlier that there had been no nursing home outbreaks since, I guess, Birchwood Terrace and Burlington Rehab, which was back in March, I guess, or early April. Is that true? And are there any particular metrics or monitoring efforts that you have to look to give you an advance warning against any sort of outbreak recurring in long-term care facilities?
Yeah, thanks for that. So, literally, we've had a small scattering of a staff member here, a staff member there, with a positive test, but no facility-wide outbreaks in any of those long-term care facilities. We've had two very, very modest outbreaks in senior independent living situations where everyone has their own apartment. These are not healthcare facilities, but they're facilities that your age has to be greater than 55 or you need to have a disability to be housed in. And though we would consider two cases an outbreak, that was all that they had in these facilities, and no spread beyond that. Anytime there's just the hint of a case, whether it's in a resident or in a staff, our entire epidemic outbreak team gets deployed. They've already been involved in a preemptive and proactive way with every facility around the state, with lots of guidance and lots of recommendations and guidance on policies that the institution should have. But at the same time, if anything happens, they're there, boots on the ground really, and making sure that they see that all the appropriate things are being done and give advice as to how to mitigate whatever infection is there so it doesn't spread throughout the entire facility. So we do have, the opportunity to have an early warning system when a staff member tests positive. That's probably our most major metric that we would follow. because obviously the residents are being followed very closely there. And though they're not being tested all the time, obviously if a resident becomes ill, that becomes a significant concern.
Thanks.
Colin Flanders, 7 days.
Hi, I was just curious whether the guidelines for retail reopening apply to museums and art galleries.
The short answer to that is not at this time. So that is, again, something that we're really looking at, and I would expect, just like the governor said, in the next couple of weeks, we will have some answers about that, and we'll be happy to share that when the time comes.
Thanks.
Steve, NEK TV.
Hello. This question's for the governor. Hello?
Yeah, we can hear you. We can hear you. I think you may have muted yourself again.
Steve?
*6.
We'll try this again.
We hear you.
Can you hear me now?
Yes, we can.
Now, thank you. Governor, constitutionally speaking, how many times do you believe that you can declare and or extend a state of emergency? Could you theoretically do this forever? And at what point does the legislature, do they come back? Will they be returning any time in the near future? And I'll take one. Thank you very much.
Yeah, I don't have the answer to that, but I'd be happy to take a look. I believe that I would be able to continue with this state of emergency until the emergency's over. But we'll take a look and get you the proper answer. In terms of the legislature, they have not adjourned yet, so they're still in session. They're still meeting virtually. And from what I understand, probably a better question for them. But at some point, they intend to adjourn and then come back at a later date, maybe in August or September, to contemplate they want to pass a budget for the first quarter. And then come back and see what happens in the meantime, and pass another budget for the last 3 quarters of fiscal year 21.
So you believe it's determined by the length of the emergency?
Well, that's my feeling, but we'll get the correct answer for you to be sure that I'm on solid ground.
Thank you very much.
Scooter, the other paper.
You had said, recommended that the local school systems have a revote on their budget. Do you think that this would require another town meeting on the ballot? Would you support mail-in voting for this vote, or would this vote be part of the primary vote? And also auxiliary to that question is a vote required? Could not a school system spend under budget? Would a revote be needed?
Again, those are details that haven't been fully flushed out. Again, we were asked to come before the legislature, present some ideas in a brainstorming session about what the possibilities are. We decided to advocate for looking on the spending side instead of how to raise taxes. And so we got to a point where we presented it. It wasn't that well received, as you might have heard, but we'll continue to work together in whatever way we can, because we are in this together, and we'll get through it, and we'll listen to one another. But I think everything has to be on the table. So some of those details I just don't have the answers to, but I think we'll contemplate those if there's any sense of revisiting that and doing something in the future. Secretary French, is there anything you could add to that that might provide some clarity?
No, I think, Governor, you covered it. You know, we're at the early phases of this, and everything's on the table.
Okay.
All right. Kat, WCAX.
I'd like to come back to the topic of child care. One of the big concerns I've heard from providers is about finances. Is the $6 million the state has promised going to be enough?
Secretary Smith.
Kat, I think you could ask any group whether it's going to be enough for money, and people will say no. That's the money that we've put out there. That's the money that we think is going to be sufficient during this time period. Remember, we put millions into this system to make sure that this system did not collapse during the COVID-19 crisis when it was shut down. So, you know, this is in continuation of money that we have already, millions that we've already put into the child care system, just to make sure that we can get to the point we are now. The $6 million is for grants to help them get the various supplies and sort of the various space that they need in order to comply with the pretty rigorous health and hygiene requirements that we have put in place. And we'll monitor the system as we go forward. But I don't want to put just $6 million in context all by itself, because there's been millions that's been spent during this COVID-19 crisis.
So a follow-up to that, then, some parents have indicated that they're not comfortable sending their child back right away, either because of safety reasons or because they're not sure that their child care will be able to offer the level of interaction that they want their children to have. But of course, if the child doesn't come back, that leaves the small business, that child care, in a financial bind unless they give that child's spot to another family, in which case, of course, the family didn't send their kid back right away, is now trying to find child care in the future. Is the state considering extending some of those emergency payments so that families and child care don't have to make those kinds of decisions on June 1?
No. What we said we were going to do is to extend the grant period that they can apply for the various what we call restart grants to July 6. We also said we would work in terms of flexibility in terms of the enrollment and attendance criteria that is in place. And as I said in the beginning, we have an attendance requirement that you have to attend to get payment to the provider. That was sort of suspended and then went to an enrollment basis during the pandemic to make sure that we kept our system in place. We're going back to a attendance issue, but I said we could have some flexibility on how we code that and how we do other things in that payment structure. And I think that gives some flexibility to providers out there.
Last child care question for you, Mike. The providers I've spoken with have indicated that, you know, they found out through the media that they were going to be having to apply for this by May 22nd. What kind of communication is going out, and it does May 22nd give them enough time to actually make a business plan for reopening by June 1st?
Well, we tried to get as much advance notice as possible. That's why we announced it last week, I think it was. We announced it last week to give as much advance notice as possible, given the fact that we wanted to make sure that we saw the trends that we were seeing in the numbers to give them viability in terms of what class size would be. We anticipate by June 1st that class size will be 25. We had heard from many of the providers out there that if we kept it at 10, it was going to be a struggle as we move forward. So we were looking at the numbers. We gave them as advance notice as possible as we are moving forward. And listen, this isn't in a vacuum. We've been in communications through, I'm going to get the wrong term here, but it's like a webinar. We've been in communications with as many people as possible through this process, including the organizations that represent child care centers, just to make sure that there was open lines of communication. And Kat, not only that, in the beginning, as we were designing the programs that we were talking about in terms of making these child care centers financially viable during a time when there were no kids going to these centers, we were in constant communications with leaderships of these various organizations. So I'd like to say that we have been in constant contact with those, if not at least pretty robust contact with these people.
All right, we need to move to our next questioners. Ann Wallace-Allen, BT Digger.
Hi, thank you. This is for Mike Harrington. Mike, so how and when did the DOL become aware of this issue in which the $600 federal weekly benefit was paid out before it went into effect? And also, how many people were affected by this? I've been hearing from people who still haven't received any money. These are all PUA people. So I'm wondering, how long are the PUA payments stopped as you guys sort this out?
I believe I answered that earlier in the press conference, but what we were able to find out, as I'm looking at the calendar here, we were able to identify in late April and mainly I think during the week of April 26th that there were payment issues, and also the week of May 4th with people who had received additional money in the early weekly claims that they had filed. And so during those 2 weeks, as we began to see this, we began putting in corrective actions to make sure that the proper calculations were being put in place. I think we had originally hoped that we could make some payments this week to those individuals, but still needed to make corrections. But in terms of those people who had filed prior to May 1st, there was roughly, I'd have to go back and look, but I want to say it was somewhere around 8,000 people who had received essentially additional payment, but then people who had filed after May 1st have already received payment, both for those earlier weeks as well as the current week.
So how many people have successfully filed their PUA claims but haven't received any money yet?
I'm the only ones that I'm aware of that have filed a claim that maybe their claim is on hold are less than 1,000 people, and we are typically able to resolve those issues within in under a week.
These are people telling me their claims aren't on hold, that they've been told that everything is ready to go and they should be receiving payment, but they haven't.
Okay. I can't tell you a specific answer without knowing the details of that specific claim, but I will say, for instance, if someone filed after May 1st, as I mentioned, we were able to process payments on Wednesday, Thursday to those individuals. But if they selected check as their mode of payment, that typically takes somewhere between 4 to 5 mail days to be received by the individual. So again, it's likely that someone may have filed after May 1st. They were paid this week, probably Thursday, yesterday, where most of the payments went. So it is likely they will receive a paper check by early next week sometime.
And this is the very last follow-up to this. So is this the technical issue that you mentioned last week that was related to the $600 federal benefit?
Correct. So these were, when we paid for early claims on the week of March 15th and the week of March 22nd, the system added the $600 FPUC payment to those weeks. However, the FPUC program did not go into effect till March 29th. And so individuals during those weeks received that $600. So part of this correction is also about offsetting accounts to make sure that everybody is receiving the accurate amount of federal benefits.
All right, thank you so much.
Thank you.
Madeline, the other paper.
Hi. Concerning the proposal to have school districts hold a budget revote, I was wondering what, if any, impact would that have on a district like South Burlington where a vote is already warned for this month? I was also wondering, I think there was discussion yesterday of holding such a budget revote in late summer or early fall, and I'm wondering if there is any concern about South Burlington hosting a vote in 2 weeks.
I believe we've answered that before, but I'll let Secretary French answer that further in regards to South Burlington in particular.
Yes, hello. Once again, our proposal was on a general level. It really wasn't meant to provide specificity in terms of how it would be enacted. So we didn't contemplate any impact on the budgets there's about 19 school districts that don't have approved budgets at this point. So we didn't go that far in our proposal to do that analysis.
Thank you.
Austin, Burlington Free Press.
Hi, yeah, I just wanted to loop back to the lodging stuff, and is my understanding correct from Greg's earlier question that it's basically the honor system that the only proof required for getting a room of some form is the questionnaire that's referenced on the ACCD site?
Secretary Curley.
Yeah, I mean, if you want to call it the honor system, we have directed all lodging to collect these certifications from anyone who is booking a reservation to stay with them. If there were to be an outbreak and we were to need to trace, we would ask for these certifications. So again, a big encouragement for people to comply. So depending on how we define it, you could call it honor system, but I would encourage people to think more broadly than honor system and do the right thing.
Yeah, I understand the reasoning there. I was curious why something more official or substantial than a self-filled questionnaire wouldn't be, or was that considered?
Do you mean like a legal affidavit or something?
Well, I don't know, what proof? I guess it seems so hard to substantiate beyond someone's word that I didn't know if there could have been something else that was considered or otherwise.
Sure. Commissioner Sherling, are you on the line? Still, I wondered if you might.
I am.
Yeah, might be able to articulate our thought process about how this will work.
Yes, we did contemplate having a variety of different potentially legal instruments. Some of them require notary public, so we tried to just create a simple system for folks to attest that they had met the requirements. As Secretary Curley mentioned, if there's an outbreak, not only will the state map that back, and there are potential consequences, as folks are aware. But for lodging operators, I would also encourage them to contact their insurance companies if they operate in a way that's in violation of an executive order. They may or may not be covered, and they may bear liability as well. So there's a lot of parallel systems that are designed in to create compliance. And all that said, we go back to the beginning, which is Vermonters have been very compliant and have heeded the warnings, have heeded the health guidance, have paid attention to the executive order, and that's why we're in the position we're in, which is relatively positive under the circumstances.
Thank you.
Okay, thanks.
And, Guy Page.
Hello, Governor. Would you consider allowing churches to meet at 25% of capacity with safety guidelines, as you have with retail stores? And when do you plan to update these church meeting guidelines?
Yeah, I think in the next couple of weeks we would consider that, along with the expansion of the number of people who can congregate in some of these gatherings. So it's on the table. When I brought this up to someone yesterday, they were excited and thought that they could rent if we open it up to 25%, that they could actually rent it out to other activities and circumvent the 25 person aggregate rule. So there's always a ripple effect, and we have to consider everything. So there'd be strict guidelines, but it is on the table.
Thank you.
Ham Davis. Ham, are you there? *6 to unmute Ham. All right, if Ham's not there, that was go ahead.
Yeah, no, I am here. Whoops, I am here.
Almost missed you, Ham.
This is a question. This is a question for I think the governor, and then maybe something from Mike Pichek. Governor, you've talked a lot about. You've talked some today, especially today, about the elderly community. Let's say from age 65 to 100, and what my question involves not that the elderly community, but not people that are in nursing homes and not people whose health is compromised. I'm talking about people who are simply old and who either live in retirement communities or just live in Vermont itself. And my question is, in your mind, is there a separate spigot for them? In other words, should they start to move out or go out or open up in the same way along the same track that you're opening for business? And just to follow up before you finish that with, is there any way that Mike Pichek could, if this question is more than just vague, is there any way that Mike Pichek could generate data that would support a decision on a different spigot?
First of all, I'm going to refer to Dr. Levine on part of this, but I would say this is guidance. I think we find with the data and the science across the country that anyone 65 or older is more susceptible to contracting the virus. So in order to just at least be aware of that, we put out guidance that says if you're over 65 or have chronic conditions and so forth, nobody's mandating you to stay home, but it would be in your best interest if you stayed home as much as possible and remain not in contact with others as much as you possibly can. So this is just guidance. It's not the same thing. So there is flexibility in terms of that population. So again, I just want to say that the stay home, stay safe model has transitioned to more of a be smart, stay safe model.
Thank you.
Yeah, and this is Dr. Levine. Just to add to that, you know, we do lump age, immunocompromised states, chronic disease, and assume they all fit in one package and one person is characterized by them all. But you're correct. There are plenty of people over age 65 who are living in their own homes or apartments or condos or what have you, not in long-term care facilities. And you know, we have a lot of people in our aging state, as we've recognized before, but a lot of them are healthy, and they've been aging in a very healthy way. Unfortunately, when you look from a scientific basis, there is an immunocompromise associated with being, we'll call it an older Vermonter, so we won't even use an age. That's just a recognition of what happens to the immune system as one ages, even if you don't have a lot of diseases to show for it. So that's why the guidance is usually put together that way. But I would support the fact that the weather's nice, people want to take walks, people want to be out and do things, and because your age is in that group doesn't mean you shouldn't avail yourself of these opportunities to get out and do things. But again, you have to be thoughtful about it and exercise the appropriate cautions, and certainly factor in the masking and the social distancing, or as I like to call it, physical distancing, because you can be socially connected and physically distanced at the same time, and you can be outside and take no risks versus putting yourself in situations that might be riskier to your health. So I'd want to encourage that. If you look at our website and want to look at the data on age, I mean, you'll clearly see that not everyone who has symptoms of COVID or has had COVID is in that higher age group. However, it is skewed towards those who have had the more severe illness or have had the deaths being in a higher age group, which is not unique to Vermont. It's common everywhere. So again, exercising care would be the rule of thumb. And we continue to track data that is very age-related so that we will be able to comment on that as time goes on.
Thank you again.
I do have a quick update, Governor, just for Steve from maketv. Your legal counsel has confirmed what you said, that you can extend a state of emergency as long as the emergency is still ongoing.
Okay, great. And thankfully, Ham, you're not going to have to worry about that 65 for a couple more years, so you're in good shape.
Governor, I'm 20 years past 65, so I think it's a lot.
Well, you don't look it, Ham.
Yeah, I feel it though.
Well, thank you all for tuning in, and we'll get back with you on Monday with hopefully some more good news.